Hey, how's it going, everybody? Hope you're all having a fantastic day today. With today's new video, what I wanted to actually do is do a follow-up video to my previous video in which I talked about inversion therapy or traction therapy for people with lower back pain. And in that video, I explained how inversion or traction therapy can be beneficial for people with lower back pain, but at the same time, it may not be beneficial for everybody, and it could actually cause some issues for people with lower back pain if they're not careful and they don't respond well to traction. And for those reasons, I kind of talked about them in that video. However, for the purpose of this video today, I wanted to talk about something a little bit different, a little bit more precise with regards to inversion therapy. So in my previous video, I actually got two important questions that I actually got asked, and I wanted to kind of highlight them in this video by one of my subscribers. So I'll read you guys the questions right now, and then I'll kind of touch on them and explain to them my thoughts and opinions with regards to them. So the question that I got asked was, how long do you recommend being inverted for? And what is a therapeutic length you would say? So to answer those two questions, firstly, in my opinion, it's going to be different for everybody in terms of how long one needs to be upside down for, and also the length or therapeutic length is going to be different for everybody. And the reason I say that is because everyone's tolerance level is going to be different. Someone that's not used to hanging upside down may not want to start with a fully tilted inversion table and fully hanging upside down. They may not be able to tolerate that just because of the potential increase in kind of pressure with regards to their head and blood flow to their head. They may not be able to tolerate that, and they may not be comfortable with that. But at the same time, they just may not respond to that degree of traction very well, and maybe a more precise level of traction that is much smaller or doesn't have such a significant effect may be all they need in terms of producing a response. So also with regards to this, I also wanted to kind of look up some of the research and some of the literature with regards to this, and I want to kind of break down some of the findings that they saw with regards to kind of the physiological effects of using kind of an inversion table or an inversion chair or inversion boots upon hanging just upside down. One of the first studies here that I'm going to talk about, done in 1983 here, where what they did was they used gravity inversion boots, and they had individuals hang upside down at a 90-degree angle going downwards. And so what the researchers found with regards to individuals hanging upside down using inversion boots at a 90-degree angle going downwards, they found that there was a statistically significant increase in intraocular pressure, systolic retinal arterial pressure, and a statistically significant increase in diastolic retinal arterial pressure with just using it for about 3 minutes. And so the important takeaway here is that because we're getting this huge increase in pressure in diastolic, systolic, and intraocular pressure, this could pose a problematic issue for people with glaucoma, maybe hypertension, or some sort of maybe cardiovascular problems in individuals because of that significant increase in pressure and because of all the blood flow kind of rushing to the individual's head. So people in that population would need to be careful using this type of device or hanging upside down for that period of time. But at the same time, this kind of gives us a baseline for what may be safe and tolerable for individuals that are healthy, just kind of at that 3-minute mark. And also, just to expand on that, there was also a previous report done by Noss and colleagues in 1978 in which they showed that being in an inverted position increased the spinal length, and reduced EMG activity of our paraspinal lumbar musculature in healthy male subjects. And also what they stated was that it was also shown that a minimum inversion time of 70 seconds was needed in order to achieve the maximal effect of this inversion position. So what we see there is that it seems about 70 seconds may be needed for individuals to achieve that maximal position in terms of increasing the spinal length and decreasing that muscular activity of the paraspinal musculature. So with regard to that, and then finally, one more kind of study that I just wanted to touch on was inversion therapy, a study of the physiological effects, which was kind of a follow-up to what Klatz looked at in terms of the inversion boots that they were using. And with regard to this, they actually used an inversion chair, and it was tilted at a 60-degree angle. And they actually kind of contradicted the findings that Klatz found with regards to the increase in pressure. They didn't actually see those cardiovascular changes within their study, but keep in mind they were using two different devices. One was inversion boots, and one was an inversion chair. So the individual's hips were in a different position and the pelvis was changed. And also these individuals were not tilted to the same degree. So there's obviously going to be some changes and differences there at that kind of 3-minute mark, and that could be potentially why they didn't see those cardiovascular differences with regards to that statistically significant increase in blood pressure that Klatz and them found. So they didn't find it in this study with regards to using that inversion chair. So point being, guys, is when using an inversion table or any kind of device that is going to cause you to be inverted, there seems to be a sweet spot of 1 minute to 3 minutes for individuals to get kind of the maximal effects while also kind of reducing any potential side effects, specifically from a cardiovascular standpoint, that may occur for individuals or may cause problems, specifically in populations with hypertension or glaucoma or whatnot. And that's kind of the population that would probably be recommended to avoid being inverted for that period of time because of the increase in blood pressure. But point being said is this, I wanted to talk about that with regards to the length of time one would want to potentially look to hang upside down for. There seems to be that sweet spot of 1 to 3 minutes, like I mentioned, but also with regards to the length, keep in mind that the degree that you're going to be hanging at, so where that's 180 degrees, 90 degrees, 150 degrees, that's all going to have a significant impact as well, because you're going to be creating more traction, and also in theory you're going to be creating more pressure and more blood flow to the individual's head or to your head, which could maybe potentially cause problems in some individuals. So that's ultimately going to influence it. But at the same time, if we're looking at it from a clinical standpoint, precision is probably one of the most important things in determining how much degree of traction one needs and the length of time. And that would be best determined by the clinician themselves, or just if you're someone that's kind of maybe doing your own self rehab or something, just determining what works best for you would be important, and it's going to be different for every person in that case. So that's all I wanted to explain in this video. And just to clarify, if anyone's wondering how long you should be inverted for or what the appropriate kind of therapeutic length may be. So ultimately it's going to be different for everybody, and everyone's going to be affected differently in what they need. But there seems to be that sweet spot of about 1 to 3 minutes for individuals to kind of get the maximal benefits, but also kind of limiting any potential side effects that may occur. Okay guys, so that's it for this video. Hope you guys enjoyed this. And also, if you guys have any questions, comments, please leave them below. And until next time, I wish you guys all the best and a successful and productive day, and take care.